Welcome back to our Eyewitness News special report, Coronavirus in Connecticut. This hour, we are tackling your medical questions, and a little later, we're going to get into the educational impact. There are lots of parents out there right now who have a new appreciation for teachers, and there are lots of kids out there who are a bit lost trying to navigate this new and unexpected homeschooling. But let's start with the medical questions. Dr. Ajay Kumar is the Executive Vice President and Chief Clinical Officer for Hartford Healthcare. He is joining us live from the television studio at Hartford Hospital. Dr. Kumar, we obviously know you are extremely busy right now, and we really appreciate your time.
Thank you.
So first off, the coronavirus it seemingly came out of nowhere, and it has turned fast and furious. Can you kind of explain to people who are watching how this all came about?
Well, thanks for having me on the show. In December last year, we started noticing this new virus, which was a spillover from the animals in Wuhan province in China, and it affected individuals, and after that, it really affected a lot of people, and travelers and other folks. Created a significant amount of spread beyond Chinese province, and obviously after that we know it's been a history.
How does it spread? Because obviously we have seen that it is spreading very quickly.
Yeah, it is a very contagious virus. And those folks actually who took the polls earlier on in your show, I hope everybody checked 10. It is to be taken very seriously. The virus actually spreads through droplet generally. It's a airborne droplet which actually can be passed if somebody is within 6 feet of distance easily, if somebody sneezes or cough. It also passes to the surface. It can last on surface as what we call fomites for several days, also for body fluids as well. So it has multiple ways of transmission, and it has to be taken very seriously.
What are some of the main symptoms for people who are at home who are saying, do I have a cold? Do I have the flu? I have a runny nose. I have a headache. I have a cough. What should people really be looking out for to know if they should get tested for the coronavirus?
Yeah, so this virus can present in a spectrum of ways. Actually, it could be very asymptomatic. Individuals may not have any symptom. Unfortunately, that is one of the challenges we've had dealing with exposures. The second part is that generally most patients, about 80% of the patients would get some sort of a short cough at that time and fever. And obviously the other symptoms that you described, shortness of breath. Some people have presented with diarrheal symptoms as well, and headaches and malaise. And generally the fever is one of the most prominent symptoms, and it can range up to 102 and last for several days.
I want to get Dr. Kumar to some of our viewer questions. This one is coming from Fred. Is it possible to be reinfected or have symptoms recur once a person completes the recovery phase? Yeah.
So we're still learning about this virus. As you know, it's a very new virus. That's why it's called novel coronavirus. We're still in the early stages of understanding the nature and the behavior of the virus. There have been 1 or 2 cases in Japan has been reported as possible reinfection. However, they're very unconfirmed, and I want to make sure that the folks know that there is no confirmed knowledge of that at this time. So I do not know at the moment whether it can be reinfected. Most of the science has not been conclusive on that part at the moment.
Okay, good to know. Fred also had another question. Is there any proof for or against the articles reporting people only having 80% lung functionality after recovery?
Again, we're learning. There's very small studies have come out from Chinese journals at the moment, and generally what happens is that the patient actually who gets significant respiratory symptoms, what we call as a acute respiratory lung distress, those individuals may have a long time to recover. There is a possibility that it can leave a long-lasting effect, but it is, again, very early in the stages.
I think this is a great question, and it's one we've been seeing repeatedly. Obviously, restaurants and bars all across the state are now closed except for takeout and delivery. So this one comes from Susan. Can the virus be transmitted by infected food handlers in local restaurants? Basically, some people are concerned, hey, can I get takeout? Can I get delivery? I don't want to get infected.
So there's no confirmed knowledge of that it gets transmitted through the food product. But however, when folks are preparing their food, washing their hands for 20 seconds, making sure that you use alcohol-based sanitizer is very important. And if you're buying a raw food, wash it carefully and use it. but there's no knowledge of it's being transmitted through the food product. But important thing to know, if you're preparing your food at home or preparing food you're having your food in some other place, what I talked about, the surface, the fomites can still transmit the infection. So I think that's something to be careful for.
It also makes me think a lot of people have asked about Amazon boxes. Of course, we're all going online and getting these deliveries. Is there any risk to, touching the cardboard boxes or packaging that's coming to your home?
So we've no knowledge of transmission of such kind. However, I know most companies and almost every company at the moment is exercising some sort of a caution to make sure the employees are screened for any symptoms. And I hope that reduces the prevalence. In Hartford Healthcare, we started several weeks ago to make sure that the screening criteria are put together across the system for visitors and anybody who's actually even an employee. And we want to make sure that the travel ban is implemented. The folks are not traveling internationally or locally. Some of those measures, if the companies are adopting, I think we are in the safe hands. So I would not get concerned about Amazon box at the moment.
All right, good to know. This question comes from Stacy. Have there been any studies that show if you had the flu shot and pneumonia shot that this might help in keeping you from getting this? Unfortunately
not. We do not know any studies which will prevent or reduce the chance of infection for coronavirus if you had a flu shot or influenza shot or pneumonia shot.
Okay, and this one is from Bonnie. I have a lung disease and I'm in my 60s. Obviously, that means she is in the high risk category here. I am taking precautions and then some. My question is, my significant other's workplace remains open. I am extremely worried that he could contract the COVID-19 virus. And then she goes on to say, what can he do to keep himself safe? He wears gloves. The standard face masks are being called basically useless against this virus. Does this put me at risk? Should I quarantine myself in an area of her home? Obviously, you can tell she is very, very fearful, and I don't blame her.
Yeah. So I think two-part question. Let me explain the first part. The folks actually who are at high risk of getting the disease, you're right, actually the individuals with some chronic lung disease, chronic heart disease, hypertension, who are diabetics, they're at higher risk of getting a disease, and disease generally is significantly severe. So the right caution on that part and age is one factor as well. The second part is that can you get transmitted from somebody who's living with you, who's working in an environment where there's a possible exposure? There is a possibility. However, what I would advise at the moment is the employee workplace. The question is asked is that are we using the right precaution? Are we screening employees or individuals who are visiting that place, whether they have any symptoms of fever or cough or shortness of breath? And those social distancing and screening criteria are put in place, your chances are reduced. I want to make sure that folks know that washing hands is one important factor. Using alcohol-based sanitizer, the individual who comes home, make sure the hands are washed very well. Those kind of precautions would definitely help reducing the chance of infection. But it is possible that you could get transmitted to somebody who's been living with you, who works in an environment where such precautions may not be there, or somebody's out there who could expose that individual to COVID-19.
All right, this comes from Marlene. If you happen to be self-quarantined, what over-the-counter medicines can you safely take to combat the virus? I've heard so many different views on what to use and what not to use. Nobody seems to be addressing this issue on what we can take to alleviate the symptoms at home. There have been a lot of rumors about ibuprofen, Dr. Kumar, about whether that's a good drug to take or not.
Yeah, I think safest bet is acetaminophen, using the cold compress, usual old remedy to make sure the fever comes down. Some nasal decongestant or cough medicines are safe. However, there are some studies indicating that use of anti-analgesics such as ibuprofen could be harmful. And there's a reasonably good evidence on that part at this time, so I would avoid them as much as possible.
All right, when in doubt, wash your hands and social distancing. I also want to ask you about our Vote Now poll, which the question is, how seriously are people taking this coronavirus? And I imagine you would say that people should be taking this very seriously.
Extremely seriously.
And if you can see it right there, that is the result of our Vote Now poll. People say a 9, which is very, very good. And I think
I hope it is 10 for everybody.
You're right, and that's what we need to strive for. Dr. Ajay Kumar, thank you so much for your expertise, and please thank all of the healthcare professionals you work with. We are so thankful for your service and for putting yourself on the front lines.